Okay, so my topic is appendicitis. So first I wanted to start off with showing you and talking about what the appendix is. It's also referred to as the vermiform. It's one of the major organs in the gastrointestinal system. It is in the right lower quadrant, and then this picture shows here that it originates at a small blind pouch at the end of the large intestine, which is the cecum that you see there, and then the little worm-like thing, as they describe it in the book, is the appendix. And so what is appendicitis? Appendicitis is the most common cause for urgent abdominal surgery in the U.S. About 7% of the population will need an appendectomy in their lifetime, which I thought was just an interesting statistic that I actually found in the book. And it's caused by an acute obstruction and inflammation of the appendix. So the signs and symptoms, the symptoms typically just start as like stomach pain near your belly button, midpoint of the stomach. Then it'll progressively will get worse. The pain will become localized in that right lower quadrant within usually it progresses pretty quickly, so 12 to 18 hours. There'll be loss of appetite, nausea, vomiting, and either constipation or diarrhea typically, and a low-grade fever. And then there's a very tender point over the right lower quadrant in between your belly button and the anterior superior iliac spine, the ASIS, and it may become very rigid. So I know when I was younger, one of my best friends in elementary school, she ended up getting her appendix removed, but she was for a whole day was puking, could not get up off the couch. She had a fever, so her mom called my dad, and my dad actually have somehow seen this before. So he told her to, go from the belly button and then the right hip, and then put your fingers in the middle of that and then push down on that point, which leads me into my next slide, which is the McBurney sign that he told her to do. And when you release that, then there's going to be a sharp pain, and she did have, there was a sharp pain on my friend, and my dad was like, yeah, you need to take her to the emergency room right away. So like I said, for diagnosis and referral, if somebody has those symptoms and then has a positive McBurney sign, they need to be sent to the emergency room immediately. At the hospital, they can also perform an ultrasound or CT scan to officially diagnose that it is appendicitis. The reason it is they need to go to the emergency room is because it's a surgical emergency, because there's risks of a rupture or a severe intra-abdominal infection. So for treatment and return to play, for treatment, I pretty much just said how it's surgical. So it's an emergency surgery where they remove the appendix, called an appendectomy. And then everything I was looking through in the literature could not give me a specific, time frame or return to play sequence for somebody who had an appendectomy. It just kept saying it's best deferred to the surgeon, and that it depends on the activity or the sport, and it also depends on the surgery performed, open versus laparoscopic. I did find a kind of range here of when they can start to return to play. So most will leave the hospital in 1 to 2 days and can return to normal activities in 2 to 3 weeks. But for athletes to return to their sport, they have to have a follow-up with their doctor 2 to 3 weeks post-surgery, and that's when they can potentially become cleared. So then I went a little further into open versus laparoscopic, just to kind of give you guys an idea of why the last slide said it also depended on the type of surgery. So an open surgery is where they just make 1 2 to 4 inch cut in the lower right quadrant of your abdomen, and it is taken out through that incision. And then the laparoscopic one is less invasive, and they do 1 to 3 tiny little cuts. And the laparoscope is put in, with the video camera and surgical tools, so the surgeon can look on the TV monitor and take the appendix out that way. Surgeons do typically choose the laparoscopic route, but if something happens like the appendix bursts and there is an infection, they typically have to go with the open route. And then again, like I said, I wanted to show you guys this because it shows why, like, laparoscopic ones, you're going to have a shorter recovery time and lower infection rates. So an athlete who has that surgery compared to the open one may return sooner, so it's not going to be the same for everyone. And then why is this important to athletic trainers to know about appendicitis? And really, the best thing I could come up with for this was that it's important for athletic trainers to know and be able to recognize the signs and symptoms and know McBurney's point, so they can identify appendicitis quickly since it is a medical emergency. Then there's less time wasted and less risk of a rupture or an infection. And then references.